I think everyone should have automatically transferred over, but I'll just start in case there's some people that are being manually signed for that didn't make it. So similar notes to last time. My name is Will Blesser. I'm a senior researcher at Margolis Center. I study payment reform and population health issues. And I'm here today to be your neutral facilitator. Not going to provide any opinions, really just helping to provide some structure to the conversation, take notes, keep us on time. We really want to hear from everybody here. So as Hammy mentioned, we're hoping to use this time to get your reactions to the updated draft guiding principles. We also want to provide an opportunity to brainstorm and discuss some high-level strategies for how those principles could be translated into action for increasing healthcare coverage. In a moment, I'll share my screen so that we can look through that list, same as last time. And yeah, and then I want to make sure too to talk about your all's thoughts on how the council could take next steps after today's meeting, since it's the last meeting, to help move these principles to action. So I'm going to start briefly just doing introductions again so we can remind the group who's on the line. So and I don't think we have as many people as last time, but I'll call on folks in alphabetical order here. Representative Dr. Kristen Baker, who I don't think's on the line. Got it. Okay. Casey Cooper. Oh, we can't hear you, Casey.
Good morning, everyone. I'm Casey Cooper. I'm the CEO of the Cherokee Indian Hospital Authority here in Cherokee, North Carolina. And the Cherokee Indian Hospital Authority is a component unit of the Eastern Band of the Cherokee Indians. It's a health system that's now managed under Indian Self-Determination Agreement.
Dr. Shannon Dowler. Don't think she's on the line. Reg Henderson.
Hi, good morning, everyone. Again, good to see everyone. I'm Reg Henderson, Vice President of Government Affairs at Lowe's Companies, the home improvement people.
Senator Ralph Hayes. Also don't think he's on the line. Jay Ludlam. Dr. Kenya McNeil Trice. Dave Richard.
Hi, it's Dave. I'm here. I'm the North Carolina Medicaid Director.
Dr. Tunde Sotunde.
Tunde Sotunde, Blue Cross Blue Shield, North Carolina.
Margaret Weller Stargell.
Good morning. I'm Margaret Weller Stargell. I am President and CEO of Coastal Horizons, which is a behavioral health and primary care organization. Glad to be part of this group.
Thank you. And Patrick Woody.
Good morning. My name is Patrick Woody. I'm president of the North Carolina Rural Center. We focus our work on 80 rural counties through an economic development lens.
Perfect. And last week we had, last time we had Dr. McNeil Trice as the breakout report back. I will need somebody to volunteer for that, and I'll take the notes and put together that document. But does anyone want to volunteer?
I'll do it. Yeah.
Perfect.
Yeah.
Alrighty, let me get my document up here. Okay, can everyone see this? Perfect. All right, so we don't need to go through all this language on the front, but Hammy mentioned that there was some context added at the beginning, just to talk about the history of the council and the process and all that. I did want to go over just some basic framing. So just as a reminder, we are close to finalizing these guiding principles, and that's kind of the goal of the meeting today. We would like to finalize them so we can think about next steps. And so we are interested in getting any sort of final feedback you may have on changes before we finalize them. We'd also like to get some high-level thoughts on strategies to move beyond the principles towards action. And then I do want to discuss at the end again, next steps for the council after today's meeting. So I just have some questions highlighted here that we can work through just to keep us on track. But why don't we start, and I'll put the principles on screen. Any reactions that you all have to the updated principles, you'll note that I've highlighted in yellow some of the changes from last time, at least conceptually. And do they capture the discussion that we had from last time? We can perhaps start there. So I'll put these on screen. And there are more, of course, but I'll start at the top.
Well, I will start just for the sake of somebody kicking it off. I like this framework quite a bit. I think it's thoughtful. I think it's well done. I think it did capture a lot of the nuance in the conversation from last time. So I'm pretty pleased with it. I guess, concerns that I have is, I would perhaps like for it to be a little more explicit about the scale of the various options that are available to us, and really understanding how much each option would really, maybe in a maximum sense, reduce the number of uninsured. As a follow-up, once this is finalized and becomes, really part of the conversation in the public domain, I would love to see a pretty robust communications plan come out of this coalition, to really carry some of this messaging forward to the entire state.
This is Margaret Stargell, and I would echo all that was just said. I think, as I said before, and I'll say again, I would just continue to want to see us put emphasis on Medicaid expansion. I know that, it's a challenge, and we want to see some principles and objectives put in place that we know are doable in the foreseeable future. But I just don't think we can afford to let that just be lumped into many options. I think it really needs to continue to be a priority for us to want to see that come to North Carolina, that we want to be a beacon in leadership in seeing Medicaid expansion come to this state. And I can't emphasize that enough, and perhaps not stated as strongly as I want, but I just wanted to make that note once again.
Hey, this is Tunde. I'll go next, just because, Margaret, I'm totally aligned with you. The way I think about this is, and I've said it before, it's foundational. Healthcare coverage is foundational. If we don't have healthcare coverage, how are you going to expand access to behavioral health? How are you going to expand access in rural areas? How are you going to, ensure the sustainability of the health system? Going back to the conversation we had earlier about uncompensated care, right? So I just think that, to the point you made, that is foundational. Then we should be asking ourselves, these, guiding principles, how do we ensure that they're addressed within that context of providing healthcare coverage? So let's just use Medicaid expansion. Will it help to address improved access in rural areas? The answer is yes. Will it help to address access to care, even through alternative means such as telehealth? The answer is yes. If the Medicaid policy, which it should, it does now, we just need to make sure post-COVID we don't go back, allows, for, even if it's behavioral health and primary care services. Does it result in an efficient use of taxpayers' dollars? Yes, we did. At least from a state perspective, it does, because as we talked about earlier, 90%, of the funding will come from the feds, and then we can pretty much go down the list of, will it help to improve the health overall? Yes, we've seen this in other states. So I think, that's just the way I think about it, to your point, which is, what are we trying to solve for? Which is health coverage for more people in North Carolina, particularly the uninsured, who don't have much of anything today. And then how do we ensure that these things are addressed within that context?
Tanya, I love the way you framed that. And I think the way I think about what the principles are, and I think what you decided, it's almost becomes as members of the General Assembly are trying to walk through this, and the governor and the negotiations, it's probably not a checklist, but it becomes a place to judge against, right? If we have the right principles that we've set in place, which one of these solutions, or there are multiple solutions that try to get us here, right? Then as you're trying to put it in that sense. So I think the say this the right way, and I know Representative Baker's not on, or Senator Heiss today, but I think in trying to channel them a little bit, right, in terms of this conversation in a General Assembly, is that this is going to be a process that they'll have to go through. So what we hope these principles are, as you described it, is that we can all agree these are the most important things. Then you've got to weigh all of these against each other. I loved your point today, and it was pretty stark, right? Is that if you do limited expansion without the ability to get the enhanced match, it costs significantly more than it does to do full expansion. That doesn't make a lot of sense, but there are the politics of that we have to all think about as we work through it. But again, as you're thinking about high level principles, and how do you bring these in, really focusing on we've got to maximize coverage, and maybe some, and it might be in the overview, but I think your words about without coverage you don't have anything, essentially.
Yeah.
I think we have to say that pretty much up front, that coverage is the most important thing that you can do in this process, and we've got to figure out how to get as far as we go. Yeah,
I agree, and if I could just interject one thing, Tunde has continuously reminded us that healthcare coverage is foundational, and I don't think that can be stated strongly enough. It is absolutely foundational, and if we don't do those foundational things well, nothing else is going to matter, particularly to the rural places that I care about.
So this is Casey, and I don't know that I necessarily have anything to add. I just wanted to kind of restate something. It looks like this revised version of the principles is really good. I think it captured the essence of certainly of our conversation, except that there was one topic we talked about last time that I don't think got captured, and maybe there's just not a good way to do it. But we had a brief discussion about zero harm, about any action coming out of this group had to result in zero harm, to further exacerbate the problems with sustainability of health systems and inadequate access and that kind of thing. And it's kind of picked up in the sustainability of health system principle, but it's not really stated strong enough. And again, I don't know if this may be too much in the minutia to fit into a principle. But I think there's a couple things. First of all, there are current programs and services that are at risk of being cut because they're currently not financially sustainable. And I think that inaction could actually result in reductions in services. The other thing I want to say, just for this group, we don't necessarily need to report this out to the whole group because I don't think everybody's interested in it. But for the tribe specifically, failing to expand Medicaid is costing us about $7 million a year in additional revenue. And it's my understanding, and Dave, correct me if I'm wrong, expanding Medicaid for American Indians and Alaska Natives would be matched at 100%. There'd be
Correct.
absolutely no increased cost to the state, but this decision is costing us $7 million a year for a small little health system up here in the mountains.
You know,
And I'm glad. Oh, I'm sorry, Dave, go ahead.
One thing I was going to say is that Casey, I think that's such an important point, and I know that Senator Heiss really cares a great deal about what happens on the boundary and what you guys are doing there. I think that's something that we probably need to just on the side make sure he understands that as well. Is that cost? Yeah.
And I was going to say, I heard you say, Casey, that not necessarily to share with the group, but I think that is important. That information is important to share with the group. And so I'm glad it's noted.
I agree.
Yeah, I mean, it just goes back to this whole uncompensated care, because that's, you know, the hospitals, the healthcare system is pretty much bearing the brunt, but somebody is paying for it somewhere, like, you know, to Casey's point. So I totally agree with what you just said.
I was just going to add, Casey, if anything that I've captured makes you feel uncomfortable, please let me know and I can change it from the document.
In looking at the principles and just hearing, you know, all the feedback here, I mean, I know it's listed 1 through 10, and then they're guiding principles, and we talked about healthcare coverage is foundational. I still think there's an opportunity here to make it clear that the healthcare is foundational, and some of these other things, like not just saying, okay, this is a list of 10. If you really want folks to understand where you're trying to go, you talk about the maximize the healthcare coverage, and then the other tenets that support it, you kind of prioritize them, like what is most important or what could even be included in when we think about maximizing healthcare coverage. Coverage that's comprehensive. I see we've defined what comprehensive is, and if we're going to do comprehensive, it is. I looked at the definition. It has the mental piece. Does it? Is that another guiding? Is that a separate guiding principle? If your first tenet is principle is to maximize comprehensive healthcare coverage, and if we make sure everybody understands what comprehensive means, do we need some of this other stuff? It's just a question. It's not an answer, but I think the more you have, I think it starts to get lost. And like, where are we? You look at all 10 of these. Are we going to end up really getting to a good solution when our North Star is so big in terms of 10 different principles?
And Reg, does this capture what you were saying, essentially, kind of drawing out healthcare coverage as foundational as like the main principle, and then thinking about others as principles to help achieve that? Is that sort of where you were going?
Yes, right. And that's sort of been said, and I was just building on that. I think there's some opportunity in how this can be framed, if not just saying, oh, healthcare, maximizing healthcare is the first principle, and then we got all these other things, really making it sure that that is foundational, and it will help make, if we do offer comprehensive healthcare, and we really do that, it will solve some of the other things here.
Reg, I was looking at one of our principles is program simplicity. Sounds like what you're saying is that our principles ought to be simplistic in a way too, which is too complicated.
Yeah, right. I think they should be simple.
Yeah, I also like that. I never thought about that way. Is that the principle is that healthcare coverage is foundational, right? And that we have to get more coverage. And essentially, many of the things below what we've done or ways in which, I say they're not strategies, but they're fundamental, they're additional principles. I'm not sure what the way we'd frame it, but that these things you look at. I was thinking about, some of the things below, right? You want to make sure that you use an efficient use of taxpayers' dollars as you're thinking about coverage, right? So that's how it gets framed in there, that the business community concerns are addressed as you're moving toward coverage. So it's sort of like, and I can't get the right word in my head on how you think about that, but it's fundamentally, this is what we're doing. We have to get to coverage, and here are the things that we have to think about as we're doing that, right? Yeah.
Right.
It's kind of like the underpinnings, right?
Yeah.
Right.
That's the right word. Yeah. Reg, I might put you on the spot. I want to ask you a question. Is that I know in some of the conversations I've had with folks after the meetings and have been about, let's make sure that we're clear that the business community feels represented in this, right? And that there is a recognition of that. And I know, I know the advantages of additional coverage. Hopefully it plays through, and if you get the right levers, right, that it should reduce costs for all across the board if you have uncompensated care, taking care of those things. But are there things that I guess from your perspective, from your colleagues, that when they read this that might recoil, or if they read this they say, yeah, they've thought about me? I just wanted for you to think about that a little bit in perspective.
Okay. Got it. What is supporting the healthcare issues?
I can scroll down too.
Yeah. I think some of the challenges of big business is different than those of small businesses. So it's very different. I mean, for us, I mean, we're always looking for, I mean, we don't have the challenge. I mean, it's costly to us, but we don't have the challenge of whether we're able to provide services. We're always trying to just expand it to more so that government doesn't have to pick up that cost for, our workforce, and just making sure it's as accessible as possible, keeping the cost down to our associates as well as to our company. So when I'm look at this, of course we'd want, I mean, have you thought about efficient use of taxpayer dollars? These are some of the things that when we're thinking about providing to our workforce, we think through some of these same principles. And I guess where I'm getting to the piece about it being simple is, and maybe this is a bit short-sighted, some of this stuff, if you're going to achieve it, it can be reasonably inferred. Like if I'm talk about in my first principle that I'm going to provide comprehensive health care to all and make it accessible, some of this other stuff for us wouldn't, if you're going to do it, you would, if you're really true to making it accessible to all, you wouldn't have to, the effect of that would be reducing disparities and things of that sort. It wouldn't have to be explicitly stated in a separate principle. But that could be, this could be as a result of my experiences, not with from the government side, do people feel left out, or is it having to be said because so many times it wasn't emphasized when it should have been? Some of these things.
Should ask to, just to keep us on time. So we have about 15 minutes. One thing that we did want to achieve is, okay, so if, we've talked about the framing of the principles and perhaps having a single guiding principle. And we've talked about Medicaid expansion, which kind of addresses this question, but what would be some high level strategies, maybe if we're focusing just on, coverage is foundational, what would be the high level strategies to achieve that? We did talk about Medicaid expansion again, but I want to make sure to get the group's thoughts on that.
I mean, so we talked about Medicaid expansion, which is obviously public sector driven, but it will benefit the private sector. I think premiums on the individual under 65 market are usually, I think 7 to 12%, if I recall the number, lower. And you might say, well, but that's the individual market, but a lot of those folks are working, right, for employers, but it's just that the employers cannot, provide, either they're self-employed entrepreneurs or the employees are either smaller employers, or it could be large employers like Walmart, but they're frontline, workers that maybe don't, or part-timers or hourly that maybe don't qualify. So they would have to go to the individual market, and at least that provides some relief from the employer's standpoint. So that's one. I'm just trying to expand Medicaid expansion to just, to be broader in terms of addressing some of these guiding principles. Then the other is, I think we talked about Association of Health Plans. I kind of got, my takeaway from the conversation this morning is that it can be done. I think it was the pathway one. It would only, I think, be a solution for small group employers like less than 50, I think 1 to 50 if I recall. But at least that's, it typically, and Reginald might have a different opinion, but typically it's the small businesses, right, that are extremely challenged with providing coverage. So, that will provide some relief or relief to some degree. Reinsurance, I'm trying to remember off the top of my head, I think it's going to cost the state more, and it's not going to help those that are currently subsidized, right, and are less than 400% of the FPL. Right. So I'm not too sure why we would do that. Let me stop there.
Yeah.
Just from a coverage I'm just trying to think from a coverage standpoint. Yeah. How can we broaden coverage across the populations today that either don't have coverage or have limited coverage?
Tunde, one of the things we've thought about, like what would be some of the unintended consequences, and you did put out there about like pieces, like there could be people, if you do Medicaid expansion, there are people who are currently on our plans would then become eligible if you expand Medicaid, and then they would come off of our plans and become a part of the Medicaid expansion. Do you really want that? You have big employers who are able to provide it, and these people, they're at a premium level where they're already being covered. Do you want the unintended consequence of some of those now being eligible for Medicaid expansion and coming off our plan and it being funded from a different source? That's one of the things we've thought about. Like, do you want that to happen?
That's a great question. That's where whatever we recommend, the due diligence, to your point, you have to look at the pros, cons, risks, and opportunities. The flip side of that, though, could be if they move off, then could that then result in lower premiums because you have less folks to cover? You know what I'm saying? On the employer side, right? I don't know. But
Well, and another question I think we should ask, and I don't know the answer to it, but I would like to, I mean, it's a question that intrigues me, is if they come off of private insurance and were covered by Medicaid, what does that do? What's the trade-off for that family?
yeah.
What are they able to use with those dollars that were going to premiums
Mhm.
that they could now use, to
Yeah.
further their children's education, or, meet
Yeah.
up for housing needs or other needs?
The one thing that intrigued me about the Georgia presentation, I'm sorry, Patrick.
I was just going to say, I don't think it's a given that that it would be a bad thing in terms of long-term outcomes for individuals and families.
Yeah.
The thing that intrigued me a little bit about Georgia, and I believe you could craft a full expansion this way as well, was the idea for people that had employer coverage, having Medicaid pay for that premium or that whatever cost in there. And we do actually do that in a couple of very small programs right now inside of Medicaid. But that might be, I mean, as you think about unintended consequences, I'm not sure if that's better or worse, right, for some of the broader questions that we ask, but it is something that we should actually think about and design, right, if we're going to get there.
Yeah, that's a good point, because I'm just thinking of an analogy, with the duals that have Medicare and Medicaid. So that's exactly what happens. Medicare pays whatever they pay, and then Medicaid picks up the rest. So, the individual, the senior is pretty much, I mean, doesn't have any significant or material out-of-pocket impact. So you're right, you could do something similar. That's a great point. And remember, and Dave, keep me honest on this, I think this, at the end of the day, the employee has the choice, right? So they can stay on their private coverage or move over. So it's not like a zero-sum game.
That's correct. That's right. Yeah, people have a choice. And what I think I'm correct of, what I hear is that there is, when states do this, there is that shift that happens for some people, but it doesn't happen automatically, right? People stay on plans. There might be other reasons there, but again, it's intriguing to me, the incentive to stay on a plan, if you could cover it, it's better for this, probably better for the state, because it's probably less expensive than what our cost would be. I'm not sure it's better for the large employer, but but I think something to consider.
Yes, it is. So it is more affordable, irrespective of who's paying. Let's just put that aside. It is more affordable because the Medicaid reimbursement is set at a certain level, and it is what it is, and you got to work within whatever that what's it called, reimbursement level is, and providers do. They figure it out.
So this is Casey. I have a question, and I don't know if it's going to be helpful to getting to what William was wanting with regards to strategies, but I was just trying to think about this possibility of shifting from group employee sponsored health insurance to Medicaid, but at 138% of the federal poverty level, we're talking about a single individual making $8 an hour or less, I think, if I did the tables right. If I read the tables right. And for a single parent with one child, we're talking about $10 an hour or less. So for example, Reginald, at Lowe's, your average wage is probably closer to $13, right?
Right. Yeah.
Yeah. So, I mean, we're not talking about there being a big risk, I wouldn't think, of people moving, with good group employee health insurance over to Medicaid at 138%. Unless I'm just missing something. It feels like the risk or the possibility of that's really low. And, anything that we can do to help people stay, just maintain the coverage they have, I think is the right thing. But William, you had asked a question specifically about strategies, and I kind of got lost in the question.
Yeah, no worries. I'm just thinking about, so if we agree, for example, that healthcare coverage is foundational, is the ultimate guiding principle here. We have certainly discussed Medicaid expansion. What would other potential strategies be to achieve maximizing coverage other than Medicaid expansion?
Oh.
Is there anything else we want to put on the list?
Well,
And-
I mean, another strategy that we've already talked about, and I know this is overt, but it's making group employee health insurance more affordable, which means you have to reduce the overall cost to the plan, and you really won't reduce the overall cost until two things happen: until there's less uncompensated care and cost shifting, and until people have better access to primary care and they stay healthier. Right? I mean that. So. I don't know. It feels like we just keep circling back and back around, and really everything that we're talking about trying to achieve is a function of maximizing the number of covered lives, population health, cost reduction, access to care, lower cost of insurance for large employers. Everything is a function of maximizing the number of covered lives.
And maximizing the number of covered lives comes through Medicaid expansion.
That's right. Thank you, Margaret.
Just on a broader strategy approach, I think, clearly I agree 100% with that, obviously, and I think us on the team, I think we've got to be a little bit cautious in our principles, that what we don't do is drive it to that place to where, obviously the Democrats would support it. We've got Republicans that I think would support it, but they've got to figure out how to get there. And so I think the thing that we've got to be a little bit cautious of is that we don't hit them over the head with it, right, into principles, so they can support the principles, which then allows the governor to work with them to do that. But yeah, at the end of the day, on a logical approach, right, it's hard to argue. I don't know how you can logically argue against expansion, but.
Got it. A couple minutes left. The next question I'll ask, just while we have a couple minutes, we briefly talked about this, but after today's meeting, after the council stops convening for the time being, what are some next steps that you all would like to see come out of the council? We talked about a robust communication plan for how to roll these out across the state. What other things would you like to see follow this work?
Maybe what could we or would we do short, medium, and long term, right? So what are the actions that we can take in the short term, and then maybe in the medium to long term within, the construct of these guiding principles? So, and I think maybe it was Reginald. Somebody said it really comes down to prioritization. Where's the low-hanging fruit? Medicaid policy ensuring access to telehealth for primary and behavioral health care services is low-hanging fruit. And
we just want to make sure, Tunde, that we don't stop by nibbling on the low-hanging fruit.
Amen.
Right.
Amen.
Totally agree, which is why I said short, medium, and long term.
Yeah.
So it's kind of like a roadmap. You lay it out and it keeps everybody honest, right? This is where a starting point, and this is where we want to end or go to eventually.
And I think too, that, the communication plan going out is certainly essential for this council to say that this is what we've achieved when we were together. Beyond that, what do we do? Who's accountable for following up on that communication plan and for seeing what will be implemented? Because otherwise it's just a plan that we don't have any accountability for how it goes forward.
I think one of the great things that we have is that Duke has done such a great job on this, and that we would use them to continue their work.
Then, yeah,
Yeah,
to see that continue.
You got 20 seconds.
totally agree with that.